The variant is causing outbreaks across the U.S., hitting states with low vaccination rates particularly hard. With mask mandates being reinstated in Los Angeles, the question is, are masks coming back? Should they be mandatory again? And what do we need to know to continue to protect ourselves? Neuroscientist Dr. Bankole Johnson joins us this morning with more on that. Good morning to you, Dr. Johnson. Thanks for joining us.
Good morning, and thank you for having me on your show.
Of course. You know, the most obvious question I want to ask you is, should mask mandates be reinstated? But before we get to that, I kind of want to get some perspective here. How significant of a risk and of a problem is the Delta variant when it comes to infections?
The Delta variant is highly contagious. That means that it is at least twice as contagious as all the other variants. In fact, it is likely that if you are not vaccinated, the chances of getting the Delta virus are very high.
Now, we're seeing in the vast majority of the cases of people who have been infected and hospitalized that these are people who have not been vaccinated. So naturally, you have a lot of people who are vaccinated who say, I have nothing to worry about. Is that the case?
It's smart for people who are vaccinated to also wear a mask and to take precautions. This is because they can still spread the virus. It's very important to consider viral spread in two ways. One is the effect on the individual and the effect on the community. So I would suggest you need to wear a mask for the community, even if you have been vaccinated. Also, the vaccination is not 100% protective. The highest rates that I've seen has been with the Pfizer vaccine, which is about 88% protective. And for those who have received the AstraZeneca vaccine, it's only 60%. So you can still get the Delta variant form of COVID-19, even if you have been vaccinated. So it's smart to wear a mask.
So speaking of transmitting the virus and perhaps you yourself not suffering from significant symptoms, let's talk about kids, right? Because young kids can now get the virus ages 12 and over, depending on can now get the vaccine, depending on what vaccine you're talking about. How important is it that kids get vaccinated in order to slow the spread of the Delta variant?
This is a very controversial point, and it is actually quite troublesome for most parents. The results would show that for kids over the 12 years of age, it is actually a good idea to get vaccinated. But, you know, the data is still out and still early days. The best precaution, I would think, is to have proper mask mandates in school, proper social distancing as kids return to school after the summer break, and to make sure kids do the normal things like wash their hands, take their breaks properly, and also to be able to communicate symptoms to their parents and to teachers. For most schools, for example, like the school my kids attend, there's a daily check for all kids, and I think that that's very important to be able to stop the spread of the virus.
So given all of this information that we've discussed, I know you mentioned you encourage people, even those who are vaccinated, to wear a mask. Do you think that local jurisdictions, local and state government, federal, that they should reinstate a mask mandate? Do you think they should go that far?
I think, unfortunately, this is a bit of a roller coaster. We are not completely out of the woods. And even the World Health Organization has said we're not completely out of the woods. Some local mask mandates might be necessary. Public spaces may need to have mask mandates. And certainly buildings where there is a high density of people will need to have mask mandates. So unfortunately, it seems like we're going to have a bit of a rocky fall, especially since we may start to get individuals who have the flu, and the flu will then become a complicating factor for COVID-19. And no one would really know whether you have the flu or you have COVID-19. And if you have both, then that is really not a good outcome.
Well, I think the takeaway here is if you can get the vaccine, go ahead and get it, because the Delta variant still poses a risk. For those who are vaccinated, those who aren't, of course, you know, the symptoms can be lessened if you are vaccinated. Good to know all of these tips. Appreciate it, Dr. Bankole Johnson. Thanks for your time.
Thank you. Have a wonderful day.
You as well. Thank you. Holly.